very good evening to all of you. Welcome to RSS Diabetes Bytes, RSSDI Diabetes Bytes. And as always, we bring you more information related to diabetes. पर आज हमारा मकसद कुछ ठेस है कि हम आपको डायबिटीज रिवर्सल, जो कि एक बहुत बड़ा व्यावसायिक घोटाला हो चुका है, उसके बारे में आपकी सब गलतफहमियां दूर करें और आपको उसके बारे में सही और साइंटिफिक एविडेंस जो है वो आपके सामने पेश करे और आपको बताए कि डायबिटीज रिवर्सल एग्जैक्टली क्या है, किसके लिए है और इसका सर्जरी के साथ, जो कि बहुत व्यावसायिक रूप में कहा जाता है कि ये डायबिटीज सर्जरी है या मेटाबॉलिक सर्जरी है, तो हम वो देखेंगे कि वो रियली क्या सर्जरी है, उसके क्या लाभ है और उसके लिए कौन से पेशेंट्स सिलेक्ट किए जाते हैं. तो I welcome a very warm welcome to a very elite panel of diverse experts and yet very well connected as well. May I welcome Dr. Shashank Shah, who is who we've had the pleasure and honor of having with us for the first time. I also welcome Dr. Neeta Deshpande, who is our RSSDI, a very close associate in RSSDI, one of the core members who's working towards, the obesity task force and other aspects of RSSDI. And we also have Ms. Ritika Samaddar. A very warm welcome to you. And you will see how each of these experts really laid out for you about diabetes, about bariatric surgery, and about weight loss and how it's all connected and what exactly is diabetes reversal. So let me quickly introduce our panel for today. Dr. Shashank Shah is a pioneer and leading laparoscopic and bariatric surgeon in India. He has served as the president of many national organizations of obesity, like the Obesity and Metabolic Surgery Society of India, International Excellence Federation, as well as the All India Association for Advancing Research in Obesity. He's been the only Indian to be invited as a visiting professor at universities across the world, the first surgeon in the world to be awarded the Vivian Fonseca Scholar Award by the prestigious American Diabetes Association for research in surgery as treatment for type 2 diabetes, and many other prestigious orations as well. His work and skills and publications are widely known, and he's also the editor of leading journals. Welcome, sir. We also have Dr. Neeta Deshpande, who is a top-notch diabetologist and bariatric physician at Belgaum Diabetes Center, Children's Diabetes Center, and Weight Watch Obesity Center in Belgaum. She's also the professor and head of the medicine department at NM Dental College, Belgaum, and also the associate professor of medicine at the USM KLE International Medical Program in Belgaum. She and many of you might have already known her and seen several presentations of her on obesity and diabetes in national as well as international meetings, and she's widely published, has also been the past chairman of Karnataka RSSDI, has several orations to her credit, and importantly, she's the coordinator of the Obesity Consensus Group RSSDI for the clinical practice recommendations and for the RSSDI Task Force on Obesity. Welcome, Dr. Deshpande. And we have Dr. Ritika Samaddar with us for the first time on RSSDI Diabetes Bytes. Welcome. She's one with an extensive experience in the field of nutrition and dietetics, spanning more than 27 years. And she is a registered dietitian and presently the regional head of dietetics at Max Healthcare, New Delhi. Her special interest and qualifications are in sports nutrition as well as bariatric nutrition from the Herman Memorial Hospital, Houston, USA. She has several other qualifications to her credit and has won many awards, including the Golden Aim Awards for Excellence and Leadership in Healthcare, and is a member of prestigious professional of associations, including very recently she held the joint secretary position of the Delhi chapter of the Indian Dietetics Association. So, welcome, and a warm welcome to you all again. So, without much ado, let me jump into our burning question today and our burning topic. And I'm really happy that we have such a lovely panel to actually talk about it. So, I don't want to waste time. Let's go straight to the point, and I'm going to start with Dr. Neeta. What exactly is diabetes reversal, and is it for everyone with diabetes? Because
Yeah, yeah. Thank you for that
so
question,
if you can
Purvi.
throw
And
light on
yeah, so your question was what exactly is diabetes reversal and is it for everybody? The first question first, diabetes reversal has many definitions, but in simple layman's language, what it means is that you go off medicines and your sugars stay normal. So the exact definition is that your HbA1c, your 3 monthly average, should be less than 6.5 for more than 3 months without any medication, and that's called reversal. Now, reversal of diabetes is a relatively new concept, though it has been known in the past, where people attempt to do various interventions medically and or surgically and try to attempt to reverse their diabetes. So that is called reversal of diabetes, about which we will talk a little more in detail. The second question that you asked was, is it for all? Well, not at all. And the simple reason is that diabetes itself is a very heterogeneous disorder. The diabetes of one person is very different from the diabetes of another. There are many different varieties of diabetes, although they all look the same, and that is the blood sugar going up. So they may look the same, they may biochemically look the same, but phenotypically, that means clinical features, if you actually look at it in detail, could be quite different. The insulin secretion capacity of each diabetic patient is different. The insulin resistance in each type 2 diabetic patient is different, and hence there is no one size fits all, and therefore reversal may not be for all, especially if you have a whole lot of established complications already, or you've been diabetic for more than 15 years, 20 years. Reversal may be very difficult. Or if you have other problems which preclude surgery or which preclude the kind of strict diets that you need for reversal of diabetes. So there are a lot of exclusion criteria, what we call, for attempting reversal of diabetes. So it's not for everyone. People have to be carefully chosen for reversal of diabetes, and only then can it be attempted.
Excellent. Thank you so much for that very simple explanation. And I think the take home is that if you are someone living with diabetes and you want to find out more about diabetes reversal, the best is to discuss this with your physician before falling prey to any of the commercial advertisements claiming diabetes reversal. Let me move on to Dr. Shah. Sir, what exactly is bariatric surgery and what would be the correct scientific indications for the same?
Very important question. So, bariatric surgery was named as surgery intended to offer weight loss. We see that patients attempt various types of treatments, modalities to lose weight, but sometimes they still fail to lose weight. So, these are surgeries on the stomach or on intestine or on both. स्टमक का एक पाउच छोटा कर देते हैं जिससे भूख कम हो जाती है, हंगर हार्मोन कम हो जाता है। स्टमक को इंटेस्टाइन से कनेक्ट करने के बाद कुछ इंटेस्टाइनल हार्मोन्स भी सीक्रेट होते हैं जिससे ब्रेन के वेट लॉस सेंटर पे एक्शन होती है और वजन कम होने लगता है। तो these are surgeries basically on the stomach called sleeve gastrectomy or rerouting of food from stomach to the intestine called gastric bypass or bypass procedures. ये करते किसके लिए हैं? This is typically offered only for severely obese people, severe obesity or morbid obesity. मॉर्बिड ओबेसिटी को बीएमआई से कैलकुलेट किया जाता है, हाइट और वेट का प्रोपोर्शन, वेट इन किलोग्राम डिवाइडेड बाय हाइट इन मीटर स्क्वायर। किसी का भी बॉडी मास इंडेक्स अगर 35 से ज्यादा है, और सिर्फ सिलेक्टेड डायबिटीज के केसेस में 32.5 से ज्यादा है, और बाकी की ट्रीटमेंट सक्सेसफुल नहीं है, और उसी के साथ पेशेंट को कोई कोमॉर्बिडिटी आती है, जॉइंट पेन्स हैं, दम लगता है, स्नोरिंग की बीमारी है, डायबिटीज है, ब्लड प्रेशर है, तो ऐसे पेशेंट के लिए मेटाबॉलिक एंड बेरियाट्रिक सर्जरी सबसे बेस्ट सॉल्यूशन समझा जाता है। और ये सिर्फ सीवियरली ओबीज लोगों के लिए है, जिनको बाकी ट्रीटमेंट के बाद भी सक्सेस नहीं आता है। जनरली नॉर्मल वेट से 25 केजी एंड अबव अगर वजन ज्यादा हो, तो वो लोग इसके लिए क्वालिफाई करते हैं। सर्जरी दूरबीन से होती है और ऑटोमेटेड सुचरिंग डिवाइसेस से की जाती है, इसलिए वो अभी कुछ सालों में पॉपुलर होने लगी है, और ओबेसिटी का इंसिडेंस भी बढ़ते जा रहा है। पर ये कॉस्मेटिक सर्जरी नहीं है, ये सर्जरी इंश्योरेंस में कवर्ड है। और अगर इंश्योरेंस के इंडियन गाइडलाइंस देखते हैं, तो बॉडी मास इंडेक्स 35 से अबव और उसके साथ कोई कोमोर्बिडिटी, या बॉडी मास इंडेक्स 40 से ज्यादा हो, तो उनके लिए साइंटिफिक ऑप्शन लॉन्ग टर्म वेट लॉस के लिए बेरियाट्रिक सर्जरी ये बेस्ट ऑप्शन है।
बहुत सुंदर तरीके से आपने समझाया कि ये बेरियाट्रिक सर्जरी क्या होता है, उसमें क्या करते हैं, और इम्पोर्टेंटली किसके लिए है ये। So with that, I think I can move on to Ms. Ritika for our next question. Is there, I know this is your specialty, so if you can throw some light on if there is any special or specific diet that needs to be followed before bariatric surgery. You need to unmute yourself.
So yes, there is a specific diet which we follow, and there are two sections to it. One, of course, as we were just discussing, so post-bariatric surgery, the pouch size or the stomach size has been reduced with the help of staples. So the quantity of food suddenly becomes almost 1/10 of what they were eating. So ideally, we follow something which is called a pre-bariatric diet and a post-bariatric. Pre-bariatric is more or less one to get them accustomed to the kind of diet which probably they will follow post the surgery. So, getting them to understand the importance of a high protein diet, cutting down on their carbohydrates, etc. Also, there are a lot of research to show that if they follow something which is called a VLCD diet, which is a very low calorie diet, they actually help in reducing the liver volume. So that, of course, one has multiple advantages, but more so also helps the surgeons to perform the surgery much faster and without much complications. So yes, a pre-bariatric diet is there, but post-bariatric diet is also very, very important, because you suddenly have to realize this person who was eating so much quantity, because obviously he's a little on the overweight size, his BMI is high, so his quantity of food is very high. And because he's overweight, probably his quality of food is also been not so good. So it is very, very important that before somebody gets into the bariatric surgery, he must have one or two sessions with the dietitians, because she can probably train him in such a way so that the post surgery events are much more, it's much safer for the people, and they are able to accept the changes much better. So there is a progression from a liquid diet to a soft diet to a normal diet. And very important is that we have to talk about the quality of nutrients which they are talking. So the quantity automatically is happening because of the surgery, because the size of the stomach has been reduced. But very important is that they have to still be very focused on what they are eating, and the quality of nutrient becomes very important. If they do that, then I feel it's 100% successful surgery. Not only helps them in losing the weight, but also, as what we are discussing, will actually help them in a complete reversal of their diabetes also.
So approximately, how long before the surgery, I mean, if you have the liberty to decide that, then approximately how long before the surgery would you like to start that diet or that discussion with the patient?
Right. So again, that depends. If the BMI is very, very high, like more than 40 or 45, then of course there are set protocols where minimum for 2 to 4 weeks we would like to have the person getting into the so-called VLCD diet. But definitely, if there is somebody who is probably with a BMI of 32 or 35 with just a sudden onset of diabetes and very high sugar, and has decided to go on for this bariatric surgery for a reversal of sugar, you really need not get into a VLCD diet for that longer period, but probably just having an interaction with a dietitian probably a week before the surgery itself mentally trains the person very well how the adaptation of the diet will have post surgery, and hence the compliance to the diet and the compliance to the various steps post the bariatric becomes very very easy for them, and hence the success is very good thereafter.
Thank you for that wonderful description and discussion, because I think it's important for patients who even are headed for surgery to understand that it's not magic, it's not a simple answer, just a simple surgery day and then the next day you wake up without your problems, but it's something where you need to be mentally prepared also for the change that is going to happen. So for that, I think we need to. I think often patients are, they want to know all their options. They think that yes, maybe they are motivated enough for reversal of diabetes. But I think Dr. Neeta, maybe you can throw some light on this particular question. That what are the different ways to reverse diabetes, or that diabetes can reverse? Is surgery the only way? And what is the general percentage of success with each of these?
Right. So this is very much in the news now. And earlier we used to think that diabetes would be reversed only by surgery. But in recent years, we know now, and there is a lot of evidence to show that lifestyle modification with particular kinds of very low calorie diets can actually make one reverse diabetes. And in some of the series that have been seen, the rates of success are to the tune of 40% of reversal at the end of 1 year and 36% at the end of 2 years. And this is Roy Taylor's data. And that has been replicated in studies done in Qatar and other places. So 40% reversal with lifestyle modification and weight loss measures with diets is quite phenomenal. In earlier studies, it was very low. It was just 5 to 7%. But then they did not use those very low calorie diets. And what was this computed was that if you manage to lose 10 to 15% of your existing weight loss, then you can reverse diabetes. So the magic figure is 10 to 15% weight loss, which roughly amounted in that study to an average of 15 kgs of weight loss. Now the other thing is that even if you lose little lesser amounts of weight, you still stand a chance to reverse your diabetes. And that is why it is now known that reversal of diabetes by medical management is a possibility. Of course, you have to choose your patients well. The patients need to be motivated. They need to be given the option and told what exactly they are going into. So these are the important aspects of it. So medical management or medical reversal of diabetes is very much possible, but under supervision properly with the proper supplementation, nutrition, and all of that, and a good maintenance period in which there is a slow weaning off of the meal replacements or the very low calorie milkshakes that are used. So that is one. And second, of course, is surgery. There is a lot of success with surgery, but there are guidelines to it. You have certain uh, guidelines for the BMI, but you can do it at particular BMIs, usually at 32. If you have diabetes, then 32.5 is what most societies talk about as the cutoff point for trying to do it by surgery, as was already told by Dr. Shashank Shah. As such, for medical management or medical reversal of diabetes, there is no such limitation. You can actually take up any patient who's motivated and who fits the bill, and one can actually do it. So, medical and surgical are the two main ways. Of course, there is pharmacotherapy for weight loss, which can also reverse diabetes. So that is another thing that we should talk about. That is GLP-1 receptor agonists, which are available, which are licensed for use in type 2 diabetes. And these can help a person lose substantial amounts of weight with which you can actually reverse diabetes. So you have medical lifestyle management, you have pharmacotherapy, that is drugs, and the third thing you have is surgery. So these are all the different ways in which you can try to reverse diabetes. Again, let me caution, in properly selected patients with judicious use of the modality that you are using.
Excellent. I think that was a textbook answer to this question. Very well explained. So thank you for that. I think, Dr. Shah, I'm going to pick your brains to know which are the situations where even if surgery is indicated, and so far we talked about rare surgery, what are the kind of patients you would take up for surgery. What are the situations where you would not do the surgery even if it was indicated?
So when the patient is not fit for anesthesia, so those who are medically unfit or very high risk for anesthesia, those who have diseases like liver cirrhosis, end stage, those who are known to have substance abuse or they are unable to take care of themselves after surgery, these are the commonest contraindications. There are some relative contraindications, that is patient who is not ready to follow the nutritional compliance, patient does not have enough intelligence to understand the post-operative care, but by and large, it is based on anesthesia, fitness of all the organs, and if it is clinically indicated, but because of other risk factors, it cannot be done, only then surgery may not be offered to that patient till the patient is optimized or improved to fit the criteria for surgery. The answer is simple.
Great, thank you. Thank you for that. And Ms. Ritika, do you think that so what kind of supplements do you offer your patients post surgery? And what are your some of the tips or some of the ways that you encourage the patients not to put on weight post surgery? Because we've seen that even post bariatric surgery, there are patients where diabetes may have remitted for a while, but it comes back with the weight, and so weight regain remains a problem, and weight maintenance is tough. But how do you really encourage them?
Yeah. So the first question, of course, as you said, that what are the supplements? So definitely they would really need to be on certain amount of supplements for the simple reason that one, we are talking about the portion size becoming almost 1/10 of what they were eating. So definitely there'll be certain amount of lack of certain nutrients for sure, and mostly these are the micronutrients. The second, also, we need to understand that specifically for certain surgeries like a Roux-en-Y gastric bypass, where we are, bypassing a certain portion of the small intestine, the duodenum, the stomach size is becoming very small. So definitely there will be certain amount of malabsorption of certain nutrients like your calciums and the irons and the B12s, etc. So yes, it is very, very important for the person to understand that post surgery, he or she would be required to take certain number of supplements for life. But of course, there are certain cases where we say that where the nutrition is not too good or they've been not been complying to the diet as per has been recommended, there might be certain other deficiencies also which can be seen. But again, doing a proper intervention in terms of supplementation, correcting their diet, these can all be overcome for sure. Now, the second question being, do they gain weight? Yes, they do gain weight. And that is why a compliance is very, very important. We need to understand surgery is only the beginning of a long story. So, post the surgery, they have to be in touch with their physician, the surgeon, the dietitian for sure. They actually have to be a part of a support group because that is what will actually help them be a very, very compliant person in terms of their diet, in terms of their lifestyle, in terms of certain amount of exercise which they do, in terms of being compliant to the supplements which they are taking, because all of it has a direct impact on whether they gain weight or probably they land up with certain amount of malnutrition also. So yes, it is common, and especially in a country like ours, which is like a vegetarian population, a carb loving country, it does happen quite often But that is where I think the dietitian or a bariatric nutritionist has a very, very important role to play, talking about the quality of nutrients which they are talking, and not just talking about the quantity of food.
Very well said, and thank you for that. Now I come to the crux of the matter, and something that I think not just the doctors, not just the general public, but it's important even for the doctors, especially physicians, diabetologists, endocrinologists, everyone to be really clear about this. So I come to that question, and I request inputs from both Dr. Shah as well as Dr. Neeta. So, is bariatric surgery really considered as diabetes surgery? And should everyone with diabetes undergo the same? And would it be right that we are misleading the people or public, as we call it, metabolic or diabetes surgery? So, one by one, if you can comment on this.
So who wants to go first? Shashank, you go first. Yeah.
Okay. So first of all, I must say, and I agree with Dr. Neeta, and everyone will agree that it is not for every patient with diabetes. Obviously, it is not for those who are thin. It is not for those who are not obese. It is not for those who are not type 2 diabetes. It is not for those who are very well controlled with medication or pharmacotherapy. However, I must say it is called metabolic surgery worldwide, and the main reason being all the actions of bariatric surgery are mainly hormonal. Change in the shape of stomach, excluding the curvature, cutting things into the intestine, stimulates various hormones which are known to improve metabolism, which are known to improve on the which are known to improve on the center of weight loss and improve on the ability to maintain it for longer period. And that is why any change in the structure or anatomy that results in improvement in function is known as metabolic surgery, and that is why it is called metabolic surgery, and for no other reason. It's diabetes surgery probably is a name given by people, but we call it metabolic and bariatric surgery. And that is true for everyone and anyone who undergoes it for weight loss, for any other comorbidity, for joint pain, for snoring, infertility, or diabetes. But still, it is mainly for those who have obesity of grade 2 and more, who are not controlled with newer medication. मैं यहाँ पे सबको बोलना चाहता हूँ कि डायबिटीज सबको चाहिए कि मेरा डायबिटीज कम हो जाए, पर अभी बहुत सारे नए मेडिसिन आए हैं, GLP-1 एनालॉग्स, स्ट्रॉन्ग वेट लॉस मेडिकेशंस, उनको यूज करने के बाद भी अगर पेशेंट का वेट बहुत ज्यादा बाकी है, उसकी वजह से जॉइंट पेन या बहुत सारी कमजोरी, बीमारी, ब्रेथलेसनेस है, उनके लिए बेरियाट्रिक सर्जरी डेफिनेटली एक ऑप्शन है। पर अगर किसी की बीमारी मेडिसिन, लाइफस्टाइल से कंट्रोल हो सकती है, तो वो पेशेंट वेट कर सकता है। डायबिटीज सर्जरी ये पॉपुलर हुई क्योंकि ये बेरियाट्रिक सर्जरी के हार्मोनल चेंजेस की वजह से डायबिटीज लॉन्ग टर्म रेमिशन में जाता है। इसका मतलब कुछ सालों तक शुगर नॉर्मल हो जाती है, पर जैसे वजन बढ़ने लगता है, वैसे कभी-कभी वो वापस आ सकता है, वापस उसको दवाई की ज़रूरत पड़ सकती है। पर जिसको डायबिटीज़ की वजह से कॉम्प्लिकेशंस बहुत ज़्यादा हो रहे हों, दवाई से भी कंट्रोल नहीं हो रहे हों, पेट बड़ा है, वज़न ज़्यादा है, तो ऐसे लोगों के लिए डेफ़िनेटली मेटाबॉलिक एंड बैरिएट्रिक सर्जरी एक ऑप्शन हो सकता है, पर ये सिलेक्टेड होता है। हमेशा ये डायबिटोलॉजिस्ट, एंडोक्राइनोलॉजिस्ट, बैरिएट्रिक सर्जन और पेशेंट के जॉइंट डिसीजन और अंडरस्टैंडिंग से होता है, और वैसे ही होना चाहिए।
Very
नीता,
well
to
said.
you.
Yeah. Very well said, Shashank. And I very well agree with him. And to answer Purvi's question, is bariatric surgery or metabolic surgery for every diabetic patient? Certainly not. In all the guidelines, also, it clearly mentions that if all non surgical methods fail and your body mass index is above 32.5 and you have diabetes, then you can take bariatric surgery as an option. It cannot be for all, for the simple reason that there is not enough expertise for all the diabetic patients to be handled by bariatric surgery. That is number one. Second, after all, it's a surgery, so there can be complications of the surgery as well. And third, as Shashank rightly pointed out, you have excellent pharmacotherapy nowadays, and lifestyle modification techniques have also improved. There is a lot of evidence again to tell you that lifestyle modification, those drugs can help you remit diabetes, and therefore we cannot say it. And therefore I would say that actually uh, diabetes remission is a byproduct of bariatric surgery, so to speak. But in recent times, because of the phenomenal success of bariatric surgery, it was called metabolic surgery, even by the guidelines. And the guidelines came out saying that this can be an option in people who are absolutely not able to control their blood sugars, not able to lose weight, despite all measures having been tried. So it is not the first option. It cannot be the first option unless that diabetic patient meets the criteria for surgery because of the body mass index, which means to say if you have a body mass index more than 37.5 40, that means you already meet the criteria for bariatric surgery per se for obesity treatment, then there is no question. But solely to treat diabetes, if you have low body mass index of 27, 28, it is not recommended that such patients go for bariatric surgery. There are patients coming and asking nowadays who have a body mass index of say even 26 and saying that can we do surgery and make our diabetes go away? That's not the answer, because it can very well be managed by lifestyle, very well be managed by good pharmacotherapy. It can be managed by regression of the fatty liver by lifestyle modification, and this can cause remission of diabetes. And after all, diabetes is a lifestyle disease. There is no running away from modifying your lifestyle to a better lifestyle. So, lifestyle modification is, of course, the go to option forever, because even if you undergo bariatric surgery, lifestyle modification has to continue lifelong. And therefore these are the options, and I will not call it diabetic surgery, I will call it metabolic surgery in specific kinds of patients living with diabetes.
I this was very very well said. I think both of you have really. I think there was no doubt in what you how you explained what the surgery is and for whom, and how it's connected with diabetes reversal. But I think when we have experts sending out video messages. Actually stating that diabetes surgery and discuss this with your physician or your surgeon, it tends to mislead our people. So thank you very much for bringing it to light that lifestyle modification is not something that we can run away from. It is the crux of the matter, and well, you can certainly discuss diabetes reversal and the surgery with your physician. And see if you really fit the criteria. The criteria are also laid down very well by our experts. So it's not something that just that your physician knows and you don't know. It's very well out in the open. So if you meet the criteria for that, then it can be something that you can undergo and help your diabetes as well as a great byproduct or a great advantage of the surgery, but it's not primarily to cure you of diabetes. So I think that was one thing that we really wanted our experts to clarify today for our general public. And I would ask Ms. Ritika to just emphasize if there's anything in more in particular about a post-bariatric diet that must be followed. And we have, I just want to share with all the experts that we have tons of questions today on our chat box. We will take them if there is time, but before that, let's complete the discussion that we have planned.
So even if the surgery is done, we really have to understand that diet still becomes an integral part post-surgery also. And the diet is, of course, as been discussed by the doctors, that it is a lifestyle modification. So we still have to look into eating healthy. And as I've been emphasizing time and again, that it's about the quality of nutrients. So when I talk about the quality of nutrients, we definitely emphasize on the quality of protein which they are taking. So we really want them to have something like at least 12 to 20% 80% of the calories coming from the proteins. Definitely cut down on the carbohydrates, and that's a tough job, especially in a country like India, where we are all very carb loving. So we have to get it down from, usually adult Indian has something about 70-80% of the calories coming from carbohydrates. That definitely has to come down to about 50-55%, and the fat remains the normal amount. But definitely, yes, the quality of nutrients is something which they have to look into it. Even after undergoing the surgery, only then would we say that the metabolic surgery has been a complete success.
Excellent. Thank you for that. I would like our experts to have, one final take-home message for all our patients and, our friends watching this Diabetes Bites today.
Should I take Nita?
We can, yes, please, sir.
So, one definite message which I would like to give to common people is like how we are saying that unless you have some grade of obesity, you should not try the metabolic surgery for diabetes. Similarly, I would definitely stress that if the BMI is more than 40 and if you have diabetes, maybe bariatric surgery can be one of the best options that patient both for weight loss and improvement or remission of diabetes. The best message is scientific guidelines should be followed. Evidence based medicine will always guide you. Advertisements or whatever should not be entertained, and your clinicians, diabetologists, endocrinologists, bariatric surgeons will always be there to follow and suggest treatment according to the guidelines. And once again, if the BMI is more than 35, diabetes remains uncontrolled, and there is significant grade of obesity which is bothering the patient, and medical lifestyle treatments are not successful or adequate to control it, bariatric surgery can be an option. Or those who are severely obese, bariatric surgery probably will be the only and the best option at this moment for them for long-term remission, which is under insurance cover, so which is cost effective. Of course, nutritional care is always required with whichever modality, and lifestyle management is a key. However, because of hormonal changes, lifestyle management becomes fairly easier after bariatric surgery in patients because hunger is less, craving is less. And just to answer some of the question, all bariatric procedures work well. There is remission of diabetes in different degrees. However, in bypass procedures, where the procedure is only on the stomach as well as intestines, hormones from the stomach as well as intestines work together. So they are known to be stronger procedures. There are different types of bypass procedures, but all are stronger than just sleeve gastrectomy. But if the BMI is high, even sleeve gastrectomy can be enough. And there are certain indications and guidelines for choice of each procedure in each patient, and they are individualized.
Right.
Thank you. Thank you so much for that. Dr. Neeta.
Yeah, my take home message would be one, there's good news, and the good news is that weight loss can cause remission of diabetes, any kind of weight loss. So you can do weight loss by lifestyle modification, you can do it by using medicines, good medicines, and you can use it by doing surgery. Now, which modality to be used for remission of diabetes is dictated by guidelines. The eventual decision should be a joint decision of the bariatric physician, that is the obesity physician, the bariatric surgeon, and the patient himself. But the bottom line is that whichever modality you choose, whether it is lifestyle modification or bariatric surgery, your diabetes will stay in remission as long as you keep the weight off. If you regain weight, whether you have lost weight by lifestyle modification or bariatric surgery, yes, even after bariatric surgery, you can regain weight. There are umpteen number of cases that regain weight. The diabetes will come back. So if you regain weight, the diabetes will come back. So these are messages that should hit hard, and you should know these. Ultimately, it's a joint decision dictated by science, evidence, and a meeting between the physician, the surgeon, and the patient.
Wonderful. Very, very clear and straight to the point. Thank you for that. Ritika, ma'am?
So I think whichever procedure we follow, the diet still becomes the cornerstone for treatment. Whether we are looking at weight loss with the dietary interventions or with lifestyle or with pharmacotherapy or with bariatric surgery, diet is very, very essential what they're eating. And hence the importance of diet for a diabetic patient always becomes very, very crucial. And if they're able to modify on their lifestyle, whichever procedure they pick up for their remission, it will always be successful for sure.
Great, thank you so much for that. So I think unfortunately, we are at the end of our show, and I have to thank all our experts today from the RSSDI core, our president, Dr. Brijmakar sir, Dr. Sanjay Agarwal sir, who is our secretary, and the entire executive committee as well. A very warm thanks and for all the effort that you took and came on to RSSDI Diabetes Bytes for this very interesting discussion and a very clear discussion and information given to our audience today. So a big thank you to Dr. Shashank Shah sir, Dr. Neeta Deshpande and Ms. Ritika Samaddar. Very, very thankful for you to have come today and spoken to our audience. We have tons of questions, but we will surely have you over another time where we can tease out each of these questions that our very interested and engaged audience has posed for us. So with that, I thank you once again.
Thank you so much.